When we talk about the extraocular muscles, it's also very important to understand their innervation. And as we work through the innervation of the extraocular muscles, we will summarize their innervation with a useful mnemonic. But for now, we have 3 cranial nerves that will innervate the muscles that attach to the eyeball. The 3 cranial nerves that innervate these extraocular muscles will be oculomotor, abducent, and the trochlear nerve. So we're looking at cranial nerves 3 for oculomotor, 4 for trochlear, and then 6 for the abducent. The oculomotor bears the brunt of this innervation, as we'll see. Here is your superior rectus. Oculomotor is its innervation. Here is your inferior rectus. Again, oculomotor. The rectus, that's on the lateral side. The lateral rectus, shown here in bright red. This is where we have a change in innervation to the abducent or cranial nerve 6. Medial rectus is here, oculomotor again. Inferior oblique, oculomotor. And then the superior oblique is going to be innervated by the trochlear nerve, cranial nerve number 4. Here we're looking at the mnemonic for the lateral rectus. This is going to be LR6, lateral rectus, LR, and then 6 for cranial nerve number 6, which is the abducent nerve. The superior oblique is going to be innervated by your trochlear nerve, cranial nerve number 4. So the mnemonic here is SO for superior oblique, and then 4 for cranial nerve number 4. And then the rest of these are very, very easy because all the rest of them are going to be innervated by cranial nerve number 3. This would be the oculomotor nerve. Now let's take a look again at the levator palpebrae superioris. First, its innervation is like the majority of the extraocular muscles. It's going to be innervated by cranial nerve number 3, oculomotor, as well. Though many of the fibers of the levator palpebrae superioris are skeletal muscle fibers, it's important for you to realize that there are some smooth muscle fibers that pass from its inferior surface and attach into the eyelid itself. These muscle fibers are very important in maintaining eyelid elevation, keeping that upper eyelid in an open position. As we are looking at the smooth muscle fibers at this particular point, they will not be innervated by the somatic fibers of oculomotor number 3. Instead, there will be sympathetic fibers that will innervate these particular smooth muscles. This has clinical relevance in the case of a lesion of sympathetics, or if there's a lesion of cranial nerve number 3, the nerve that is conveying these sympathetic nerve fibers. If there is a lesion of these sympathetic components, this can result, for example, in Horner's syndrome. And one of the symptoms, or signs, if you will, of Horner's is a drooping eyelid, and this is known as ptosis. So the upper eyelid will be in a depressed state.